To the people out there who are panicking about coronavirus, my biggest advice is to not panic. Coronaviruses describe a large family of viruses. These viruses are responsible for most of the common colds that circulate every year. COVID-19 is a very specific coronavirus, which is new and was first described at the end of 2019. Symptoms of COVID-19 specifically are fever, shortness of breath, and cough. Other people have described a runny nose, congested nose, sometimes sore throat, and occasionally diarrhea. The virus spreads through respiratory droplets and can spread person to person through either coughing or sneezing. We also know that the virus can live on respiratory droplets that do fall onto surfaces, laptops, doorknobs, counters. It is possible for people to become infected by the virus by having touched a surface where there's respiratory droplets containing the virus and then touching their face, eyes, nose, or mouth. The mortality rate for COVID-19 right now we think is about 2 to 3%. That may change as testing increases, especially in the continental United States. So I think that number we will know more about in the upcoming weeks to months. Some people who might be at higher risk for particularly complications of the virus are older people or those with chronic underlying medical conditions. So we think about heart disease, diabetes, maybe lung disease, COPD, cancer, and chronic conditions like that. UAB particularly as it relates to coronavirus, right now we are preparing for any cases that we may have coming through our health system. We have plans in place to screen patients before they even enter our health system, whether it's the clinic, the ER, or our urgent cares. And then we have plans in place for what we are going to do as a health system if we do have widespread COVID-19 activity and how we are going to support our community. As of right now, we do not have any confirmed cases of coronavirus 19 in the state of Alabama. It's a rapidly evolving situation with new cases popping up around the country. Yesterday, the first case was announced in Tennessee, and so we are actively monitoring the situation, and if we do have a confirmed case of COVID-19 in the state of Alabama, then our state and local health officials will let the public know. Some preventative measures that everyone can take, it includes washing your hands well and often with either soap and water or hand sanitizer. Make sure you wash your hands for at least 20 seconds, and the CDC has excellent visuals on the best ways to wash your hands. Otherwise, we know that this respiratory virus can live on frequently touched surfaces, so make sure that you disinfect commonly touched surfaces at least once a day or so. If you're sick, we recommend that you stay home for at least 24 hours after you have your last fever without using things like Tylenol or other anti-inflammatories to break your fever. And if you're sick, make sure you call your healthcare provider before being seen at a physician's office. Otherwise, as best you can, try and avoid being around people who may be sick. If you yourself are coughing or sneezing, make sure you use a tissue or the sleeve of your clothes to cough or sneeze into, not your hands. And try as best you can not to touch your face with unwashed hands. There are a lot of myths circulating on social media, so I would recommend everyone obtain their information from very validated sources. The CDC's website has some great information on it for the viewers. Also, your state health departments have websites with some excellent information, and with any other questions, you can call your healthcare providers as well. I think everyone should have plans in place for what they themselves may do if cases of COVID-19 do pop up in their communities. I think it's a good idea to have discussions with your employers, children's schools, childcare facilities about their emergency operation plans and what they may do if we do see circulating COVID-19 in our communities. To the people out there who are panicking about coronavirus, my biggest advice is to not panic. There is nothing right now to panic about. Instead, what I would encourage everyone to do is to start having some discussions and some plans in place for what to do and how to prepare in the event that we do see community-wide spread of COVID-19 in our areas. So that includes talking with family members, talking to neighbors, talking to anyone who may be at higher risk of serious complications for COVID-19 and having some backup plans in place. I think it's an okay idea to have some extra supplies in your home just in case people are needing to be quarantined in their home if they develop symptoms. So having a little bit of extra supply of food, paper products, prescription medications, and other essential items that they may want to have just a little bit of extra supply of.